Good morning sa lahat! Good morning! Andito naman ulit ako. Magbabasa. Kamusta ang Sunday niyo? Yung Sunday ko sobrang busy, as in busy. Kasi birthday ng kapatid ko kahapon and then house blessing din the same time. So, yun. Sana naging enjoyable para naging fruitful yung araw niyo kahapon. Simulan na natin yung pagbabasa. Pregnancy. Parang ito yung mga pag naririnig ko yung pregnancy, yun yung mga exciting moment ng babae. Sana nga ako no? Mabuntis din. Balang araw. So, pregnancy. Bearing a child is one of the most natural things in the world, but the process can be a mixed blessing.
Tutlo lang daw ng PC. Parang maayo pang samad.
Iputo na ako. Ito na lang.
Diba?
Otso. Kuha na lang dyan na siya. Nadaan lang dyan na siya dito.
Ngayon si mama, sigdan lang daw. Maayo daw.
Gani, pero mas lisod dyan siya kay nagakuan siya din sa area. Natulog-tulog.
Oh?
Oo. 100, no? 100. Pregnancy. Bearing a child is the most natural things in the world, but the process can be a mixed blessing, fearful as well as exciting, tiring as well as rewarding. As medical knowledge has grown, eh, tuwa gipangita ni gipangita pa ni si Drake. Pangita niya to. Panguta na siya kung asa na. As medical knowledge has grown, so has intervention in all stages of pregnancy and birth. This means that far fewer women and babies die in childbirth. Complications can be dealt with early before they become serious. And newborn babies who are premature or sick have a much higher chance of survival. However, it also means that pregnancy has sometimes come to be seen as a medical condition that needs treating, and women feel farther removed and less in control of the whole business. The most natural thing in the world, it is, but pregnancy can seem to many women like a scary, complicated process. On one of my training programs, doctors visited a local primary care center in a remote part of Rajasthan. They saw women coming in after their waters had broken and being held by the midwife at the final stage of labor as they squatted on the floor, the most natural position, and give birth. Ah, cartoon lang. The woman then rested for a couple of hours and went home on bullock carts. These doctors were amazed how quick the entire thing was. Most women in regions like this deliver at home and hardly ever come into contact with medicine, and the population is growing healthily. Why are things so much more complicated and harsh here in the West? Hmm. Oo. Ha? Isa? Padakop lagi na. Sa live. In traditional societies, women know about every stage of pregnancy. It is a knowledge that is passed on from generation to generation. In the more developed parts of the world, grandmothers, mothers, and mother in law now no longer pass on tried and tested values and nutrition. Hygiene, rest, peace, exercise, and habits during pregnancy. And women turn to books and the medical establishment for advice. Planning for pregnancy. Your experience of pregnancy has much to do with how well your body is prepared for it beforehand. Your experience of pregnancy has much to do with how your will body is prepared for it beforehand. Many of the uncomfortable symptoms of pregnancy and some of the more serious complications that sometimes arise can be averted or alleviated if you are healthy and well nourished. Your muscle tone and you are practiced in relaxation techniques. The lifestyle program is a good guide to prepare your body for pregnancy. Risk factors. For some women, becoming pregnant carries a higher risk than usual. Before you move ahead with your plans for having a child, you should talk to your doctor and consider the implication if you are affected by any of the risk factors listed below. Some pose a more serious health danger than others, but in all cases, it is important that you and your doctor are alerted so that appropriate precaution can be taken. Serious risks to pregnancy are posed by a history of miscarriage or habitual abortion, three or more, preterm deliveries or stillbirths, pre-eclampsias, infections such as tuberculosis, AIDS, or sexually transmitted disease. If you have already had a child with a genetic or congenital disorder, you will want to discuss with your doctor implication for subsequent children. The following also need to be taken into consideration. Below the age of 15 or above 40, extremes of age increase the risk, especially for a first pregnancy. Oh my. High blood pressure or history of deep vein, thrombosis or blood clot, kidney or heart disease, diabetes, blood incompatibility, rhesus negative blood type when your partner is rhesus positive, cancer in remission, obesity, severe thyroid disorder, epilepsy, chronic anemia, physical anomalies such as small uterus or pelvic deformity, surgery or previous infection in your fallopian tubes, use of steroids or high doses of immunosuppressant for diseases like rheumatoid arthritis, drug abuse, psychiatric illness such as manic depression, mental retardation, and schizophrenia. 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 Frequent monitoring by a doctor becomes very important in this situation. An obstetrician is trained to monitor pregnancy and participate in delivery, and for some of the complication mentioned above, will need to call on the expertise of other specialists. Confirming pregnancy. A particular hormone in the placenta can be detected as early as 9 days after fertilization. Pregnancy home testing kits are designed to detect traces of this hormone in the urine. And if instructions are followed carefully, these are quite reliable. An ultrasound examination in a blood test are usually used to confirm pregnancy. Once your pregnancy is confirmed, you will be able to calculate appropriately when the baby will be due. Estimated date of confinement or EDC. Take the date of your last period, add 7 days, and then minus 3 months. Example, if your last period began on 31 of March, 31 plus 7 is equals to April 7. April minus 3 months is equals January. So, estimated date of confinement is January 7. This is based on a menstrual cycle of 28 days. If your cycle is shorter or longer than this, then adjust the days you add at the beginning accordingly. Example, add 5 days if your cycle is 26 days long or 9 days if it is 30 days long. Ectopic pregnancy. It is customary to have an early scan to ensure that the pregnancy is in the uterus. In a small minority of cases, a fertilized egg implants itself somewhere other than in the lining of the womb. In almost all cases, this means the fallopian tubes. This can be very risky, especially when undetected. The chance of an ectopic pregnancy increases if you have had an infection in or surgery on your fallopian tubes. To reverse a sterilization procedure or tubal ligation, or to dilate a tube, for example. Since periodic spotting may continue during an ectopic pregnancy, there may be no early sign until a warning pain is felt, usually on the side where the tubal pregnancy has taken place. You may also experience dizziness, lightheadedness, or fainting. If the tube ruptures, abdominal pain and hemorrhage become severe and emergency surgery is required. As soon as you suspect something is wrong, consult your physician or gynecologist. So that is all for today. Tomorrow will be on the physical changes of pregnancy. For now, bye-bye na muna. Sana may natutunan kayo. Bye-bye. God bless.